Hi everyone. So today I want to talk about a new hip or a new knee or a new joint. I have quite a few clients who have new knees, new hips. Some have double knee, double hip, men and women, or one, or they don't have it yet, but they're sort of gearing up towards one. So not necessarily older clients, although they are 50 plus for sure, but not necessarily all very old. So how does that work? So let's talk about pre-operation first. So usually pre-operation the clients start to complain about niggles in certain areas, and it's really hard to find out what that is. It's not necessarily something I recognize or can recognize because they may not even know what is going on. When they go to see a specialist, and I recognize a specialist, someone who's actually trained to do that, which is not a Pilates teacher, a doctor who's actually, done the education, then it will come out of the wash at some point by an MRI or a CT scan. And then it's up to the client whether they want to have an operation, because they may decide that they're not ready yet, they don't want to do. If there are these signals, I can already change the training with them by either taking some things out if it's painful, usually it's not, but actually by focusing on strengthening those elements to almost get them ready for the operation. Because at some point they will have to have an operation, and I'm speeding things up because usually that is what's happening. So when they know, okay, so I need to get something done, a new knee or a hip, again, depending on the level of pain or discomfort, we can easily adjust the work by taking a spring off, or by doing less repetitions, or by thinking, okay, in collaboration with the specialist, okay, what do we need to focus on to get you ready for this operation? Making you ready for the operation is also better after the operation, post-operation, because you develop such strong muscles around these joints that it's much easier to gear back or to jump back into how you were, or probably even better, because there probably won't be any pain left. So preparing you for the operation is something we can do, and that very much depends on what joint it is, but also how much pain you currently have, and also in collaboration with a specialist. That's one. Then you have your operation. You'll be probably off for a while, usually not too long though, because they make you walk, stand fairly quickly. You will have to do some rehabilitation with a physiotherapist usually, and then they will just say, yeah, you're good to go. And it doesn't take too long, unless there's obviously complications. Let's say there aren't. You can do Pilates really quickly after that. And then, and that's what I've noticed. So I have clients pre and post, and I note obviously what happens is you'll probably be quite sore, you'll be stiff with either a knee or a hip. You can't move it as much as the other leg. So we try to balance it out. We try to work both legs, not one or the other, but we'll probably focus on one leg, then the other leg, and then the other leg. And it's fine to have those differences in the beginning. I mean, it's just because you have a new knee or new hip, you will have that. At some point, the goal we want to work towards is that your legs will do the same thing at the same time again. In a private session, it's easy because we can adjust the session towards the body in front of us. In a group class, we will always, whether you do a tower class or a reformer class or an open gym class, there's always an opportunity to take a spring off, to decrease the movement, to make you stretch longer than maybe someone next to you. So there's many ways how we can work with people either pre-operation or post-operation for a new hip or a new joint. And thanks for watching again.